It's your boy. So I've been trying to find new ways to make some content, and I figured I'd start doing, you know, other things other than vlogging, because because of COVID there's no modeling shows out right now really, and people are like really sketched out also because they know I work in EMS, but I get tested every 2 weeks, but whatever. Anyways, I try my best to keep this one nice and short because I know I talk too much. So we're just gonna go ahead and jump right in. So I'm making this video. I posted a question on Facebook and Instagram. If there are any questions people have related to EMS. So I'm making this kind of like a Q&A video, if you will, about people's questions about EMS. And I didn't get a lot. I got probably like 1, 2, 3, 4, about maybe 7-ish or so, a few on Facebook and like just another few on Instagram. So we're gonna answer those questions now. And then I got a few quotes from some of the EMS providers that I know, that I called and I spoke with, and I asked them if there was any piece of advice you can give someone entering EMS, what would it be? And we're also going to talk about those, okay? So let's jump into the questions first. We're going to go into the ones that I got on Instagram. And yeah, the first question is from Ivy. She asked, what are the limitations to what you can actually do while transporting a patient? I'm not sure exactly what you mean by that. What are the limitations to what you can actually do while transporting a patient? We're only allowed to treat presenting symptoms, if that makes any sense. So I mean, sometimes we can give oxygen, like 2 liters won't hurt or won't hyperoxygenate someone. That's the thing. But limitations, yeah, the limitations. We can only treat based off symptoms and signs. You know, I guess that's an answer, right? What are limitations to what you can actually do while transporting a patient? Yeah, if the patient requests to go to a certain hospital, I think we can only bypass like 2 of them. We can't bypass any if it's a real emergency, like the person will die. Patient can't go to a specific hospital if it doesn't have what he needs. I mean, like, obviously they can go there, but you know, in the city we have a burn center, we have like a lot of them are trauma centers, but we have our trauma centers also, and certain patients meet certain criteria and they need to be taken to a specific hospital. If you bring a burn patient in, or a severely burnt, like a really bad burn patient into Bronx Leb, if they're not dying, if they're not dying, they will kind of like, they would be like, what the fuck, dude, this should have went to an actual burn center. Like, airways open, he's not in immediate death, like he's in a lot of pain, yeah, but we can manage pain en route to a hospital, like, and barely, because, you know, certain pains, you know, there's different pain criteria also. But yeah, I guess that answers your question. And then you asked the second question. It says, on a scale of 1 to 10, how stressful is it, and how much care are you responsible for giving? Well, I can tell you this, on a scale of 1 to 10, it's definitely a 10, at least for me, in my opinion. Again, guys, this is completely 100% my opinion. I can't speak for other providers. Every provider is different as far as how they treat people and just how they feel about EMS in general. So please take my opinion with a grain of salt. But I think that's the saying, right? Did I say it? Anyways, please don't take my opinion way too serious. But my opinion is something you should consider. So on a scale of 1 to 10, I answered that. It's definitely a 10 because I'm a pussy. I care a lot about people in general, and especially when they become my responsibility per se. Like when you're given a patient, you know, unless they refuse medical attention or just you being there at all, you know, they're kind of your responsibility. So I find that it's just easier to treat someone and to have someone as your patient when they feel like, you know, you guys have a connection, or not even necessarily a connection, when they feel like some sort of trust with you. And I just genuinely find it a little bit easier for me. It's easier for me to remember things and remember protocol and to act accordingly if I just, you know, pretend like, you know, this is my family member too. So I treat everybody like that, even, you know, like the people that want to fight me all the time. And yes, people always want to fight me, but we're not going to get into that. So and how much care are you responsible for giving? So I think I answered this in your last question, Ivy, and it was basically we're only responsible to treat. I mean, we're responsible to transport, right? But we're only kind of like responsible for treating life life-threatening conditions or a presenting symptom. So what I mean by like presenting symptom is that like if the patient is wheezing and we can hear wheezing with our stethoscope, or we can hear it just by listening, by talking to them, we can hear them wheezing, because we could also do that. But depending on how bad the wheezing is, of course. But yeah, we can only treat off of presenting symptoms, and I can't really do anything. I can't give you I'm not gonna give albuterol to someone who doesn't have wheezing, or they're just asking for it, you know what I mean? Like I don't know. I'm not gonna give epi to somebody who's not having severe wheezing or anaphylactic reaction to something, So I guess that answers that. Like how much care are we responsible? We're responsible for transporting and getting the patient there alive, and performing our protocols, which is different for every protocol. Michaela or Malika, I forgot how to exactly say your name. I remember you from high school, dope ass fucking dancer. But she asked me, how do you keep your cool when responding to an emergency? Now that's a really good question, because it's really hard to sometimes. But my answer to that would probably be because when you acquire when you acquire the knowledge to treat and save people, you don't look at things all the time. This may sound a little toxic, but you don't always look at this as a medical emergency. You sometimes just look at it I don't want to say a game, because it's far from a fucking game, but I definitely have a different approach after I gain my certification. I'm there to help now, you know what I mean? Like the call comes in, my Superman kit comes on, and I'm ready to help. And then it's just you're analyzing so much that sometimes the only situations I can think of that it's really hard for me to keep my cool is when I'm being threatened, or like when somebody's like being a really bad douche to me for no reason, like when I'm just there to help. But yeah, I guess that answers that. You have a different approach when you acquire the knowledge of an EMS provider. Honestly, EMT basic or paramedic, you just look at certain emergencies different, you know what I mean? Like you get a call, you're not thinking, oh fuck, this patient's having a bad day. You're thinking, oh shit, I wonder if how bad this guy's wheezing is. I wonder if he can talk. I wonder if he's awake. I wonder if you know what I mean? Like certain stuff like that. So you just have a different like mental approach to it than like your average civilian would, because yeah, I guess that's that, right? If I'm not answering your guys' question, or if another question arises based off of my answer, you feel free to comment in the comment box, and I'll either make another video answering you, or I'll probably just answer you in the comments. All right, so yeah, let's go to the Facebook ones now. So my friend Jason asked me, what is a normal response time? Also, how long are your shifts normally? The response time, Jason, is usually it's different everywhere you go, depending on where you are. I want to say in the city it's 8 minutes. Don't quote me on that. This is just I'm just like, on average it takes me like 8 to 10 minutes to get to a call. Like and then if the scene's not safe, it could take a little bit longer, because we got to post around the corner or something like that until PD declares the scene safe. But I know there's certain areas in like Cali and Arizona that their call response time sometimes like 5 minutes. Like they got people everywhere, because they can afford it. And but yeah, and also, how long are your shifts normally? Our shifts are normally, it depends what company you work for, honestly, but some companies do 24s, some companies do 312s, some companies do 410s, 5/8s, and what I mean is the hours. So like 3 12-hour shifts, 1 24-hour shift, 2 24-hour, you know what I mean? And you can do 5 8-hour shifts, like your regular 9 to 5 job, but you obviously you gotta come in for 5 days. But yeah, so that's that. Our shifts are normal. Like I personally do 312s. Because I'm also a full-time student, so I like to keep the rest of the week free. And I personally know EMS providers that do 1 24-hour shift with one company, then they do 4 10s or like 3 12s with another company, or you do another 24 at another company. And yeah, so yeah. Let's see, another question. Another question is, what emotional toll does it take on you? Mr. Dinowitz asked me this, and I'd say it takes a lot of emotional toll on me personally, because since being a fairly new responder, and I've been an I've been an EMT for I think 3-4 years now, and I also worked in an ER in an emergency room as an ER tech, and it takes a toll, because like I said, the way I approach my care is I treat everybody as if they're my own family, you know what I mean? And it's been one of my greatest assets as a provider, but it's also been one of my biggest flaws as a provider too, because you know you can't always attach yourself to someone that way, especially I don't know. I think it does take a toll on me for sure. You know, you carry a lot when you leave work, and when you come home, and when you lay down, you know, you think about all this stuff, and you question yourself, like, could I have done this better? Could I have done that better? But that's when, you know, it's important to have other EMS providers as friends to kind of just speak to and vent to about this kind of stuff, because I've tried venting to normal civilians about it, and it's worked for the most part, but it's not the same as being able to talk to a superior, you know, like a medic or a seasoned EMT. And what is your, so Mr., that was that question, Mr. Denowitz, and your second question was, what is your most memorable call? My most memorable call, I can't even process that question right. But my most memorable moment, I want to say in EMS, because it was actually in the emergency room, was the first time I ever got pulses back on a patient. You know, this patient went into cardiac arrest, and that means his heart stopped. And you know, I was on the chest most of the time. I think I got off once for 60 seconds or 2 minutes, but I spent a lot of the time on the chest because it was a rapid code, like they just coded out of nowhere. We wasn't prepared for it, so I got on the chest while they got the code card, while the doctor came in and they started the extra IV, and yeah, I would have to say it was in the emergency room. I'm just off the top of my head right now, that's the only thing I can think of. That's probably one of my proudest moments in EMS in general, ER tech or EMT. Definitely being able to say that there's someone alive today because of, you know, something I was able to be a part of. So yeah, that would be that. So Lisa Grago, my boy Dalton's mom, she's dope as fuck. I love this woman. How did you become such an amazing young man? And thank you for what you do. That's not a question, but I appreciate you, Lisa. I hope you're safe, and miss you guys for sure. So now I'm gonna just, before I wrap this video up, I want to just talk about some of the things some of my EMS friends said when I asked them the question, if you can give any advice to someone who's considering EMS or a younger you while in basic school, what would it be? And my friend Nelson, he does EMS here in the city. He's great. He's a medic actually. He says to keep in mind that sometimes you can't save everybody, and you have to learn to be okay with that. Those are his exact words, and I agree with him 1000%. You know, you go to school and you're trained to save people, but you also need to remember that there is nothing more complex, or in my opinion, there is nothing more complex on this planet than the anatomy and, you know, the conditions of the human body. Like, I just think it's mind-blowing to just try to learn every single part of it, and every single disease, every single illness, every single medication. I think it's but you definitely need to come into EMS being aware of the fact that you might not be able to save everyone, and you need to be ready for when the moment you can't, you know what I mean? So that's something I wanted to start off with. And now the other ones, my friend Sam described EMS as an abusive relationship, and I doubt we have to go into any detail about that, but yeah, that's that. My friend Joe Zuck wishes that every new EMT would pay attention to their ability to obey commands. And he would say, and functionality in general, please just know your shit. So if you're new, or if you are planning on joining EMS, just please be aware that there's going to be some times where you need to take the back seat, and you need to be willing to listen to your partner or your superiors, your medic, your CC, and or your medical director, you know what I mean? Like, you might get online medical, anyways, yeah, you need to be able to know that you don't know everything, in my opinion, and in Zuck's opinion. Don't take everything to the heart. Another one by Sam. Remember, everyone is a human being. That's one of the most important pieces of advice I've received. And I think it's made me a really good EMT. You have to remember that this is somebody's mom, this is somebody's brother, this is somebody's son, sister, whatever the case may be. It's another human being. You need to be considerate of how you speak to them, your body language, everything about them, everything about that other person. That's your patient. That's who you're there to help. You know what I mean? So you need to be very considerate of that. This is not a scenario. You're not in a classroom just like sitting down. You know, this is real life. You're responding to someone's home or work or in the street. You know what I mean? It's real life, and this is a real human being in front of you, not just a made-up person on a piece of paper. Another one from Joe Zuck says, we don't work to live, don't live to work. And I say this heavy because EMS in general could be like a black hole, you know what I mean? If you're someone like me who cares way too much about people, you know, you have a busy, rough night at work, you come home, you need an amaretto sour, you want to, oh, that's my favorite drink. You need a drink or something, and you just need time to lay down and relax. But it's important to detach yourself from work. And what I mean by that is just remember while you're there that you have a life outside of this, and you have a home to come to. You might have a partner, you have a family, a mom that loves you, and you need to just be able to detach yourself from work, because it could be very mentally consuming, especially depending on the person. You know, I know people who've been in EMS for years, and you know they don't even dream about any of the stuff. And I met people who've been in EMS for a few months, and they're already dreaming about their first call. You know what I mean? So it all, you know, differs from person to person, but just fair warning. And last but very not least, we're gonna say what my boy Kyle Beach wants me to say, and it's to stay healthy. That's probably one of the most important tips in EMS, because you wanna make sure you got your proper lifting mechanics, and you wanna just make sure you're doing everything right. Oh, excuse me. Oh, that was bad. You wanna make sure you're introducing certain workouts to your body that you know for sure you're gonna be doing at work. Hopefully you don't have to do a lot of deadlifting at work, but I lost count of how many times I've had to deadlift somebody out of a position. You know, you find people in these weird locations, weird positions, and people are all heights. People are, you know, some people ask for the stretcher to go really, you know what I mean? So just be nice to your body, be smart, eat healthy, try your best to eat healthy, I mean, because I know for a fact I've fallen victim to this. I like to call it the freshman 15. When you become a new provider, you're making a little bit more money than you used to, and not a lot, but you're making a little bit more than you used to, and you're just buying food left and right, and you know, it's not always healthy. But yeah. I'm gonna end this video now because I know I've got a lengthy video right now. So I appreciate you guys tuning in. If you guys have any other questions regarding to work or my work or my dance stuff or my modeling stuff, please feel free to ask in the comment section below. And if you like this video, give it a thumbs up, and don't forget to subscribe. I appreciate you guys coming in and tuning into this video. Keep killing it. I love you all. We're at 300 subs, baby. Roll to 1,000. We're gonna get them before the end of this year. I promise. I fucking promise. Alright? Love you guys. Later. Thanks again for tuning in.